Imagine this. You walk into your doctor's office feeling completely fine. No pain, no warning signs, no strange symptoms. You are 73 years old, still driving yourself to appointments, still enjoying your morning coffee, still living life on your own terms. Then your doctor looks at your chart and says something that sounds harmless. You know what? Let's run a few extra tests just to be safe. And because it sounds responsible, you agree. 6 weeks later, everything has changed. Now, you are sitting across from a specialist, hearing words you never expected to hear. A small, abnormal result has turned into another scan. That scan has turned into a biopsy. The biopsy has turned into a procedure. And the procedure has brought risks your body was never prepared to handle at this age. The most painful part? You never felt sick in the first place. This is the side of routine testing that many older adults are never warned about. Not because doctors are bad, not because medicine is useless, but because after 70, the equation changes. The question is no longer just, can we find something? The real question becomes, if we find something, will treating it actually help you live longer, stronger, and better? That is the conversation we need to have today. My name is Dr. Victor Halston, and on this channel my focus is very simple, helping adults over 60 understand what medical research actually says, in plain, honest language, not rushed explanations, not checklist medicine, not 5-minute appointments where important questions never get asked. Over the years, I've spent a significant amount of time studying real patient outcomes and the patterns that don't always get discussed openly. What happens when the system runs on autopilot? What happens when routine care isn't adjusted for age? And what happens when well-intentioned decisions lead somewhere no one expected? Today, I'm going to walk you through something that may challenge what you've always been told. 5 common medical checkups that many people should seriously reconsider after the age of 70. And more importantly, why? Before we go any further, I want to ask you something simple. Where are you watching from today? Drop your city or country in the comments. I read more of these than you might expect, and it genuinely helps me understand who I'm speaking to, what part of the world you're in, and what kind of healthcare system you're navigating. And if you're watching this with a parent or someone over 70, mention that too. All right, let's get into the most important concept you need to understand before anything else. Before we talk about specific checkups, there's one concept you need to understand. Without it, nothing I'm about to say will fully make sense. I call it the longevity lens. When you're 45 or even 55, routine screening works beautifully. You find a problem early. You treat it early, and in many cases, you gain decades of healthy life. The math is simple. The benefit clearly outweighs the risk. But after 70, that math starts to shift. Not slightly, dramatically. There are 3 reasons for that. First, many conditions that show up in screening at an older age are slow-moving. They exist, yes. They may even technically be labeled as disease. But they are not aggressive. They are not urgent. And in many cases, they would never actually impact your life. You could live the rest of your years with them, without ever knowing they were there. Second, your body's ability to tolerate intervention changes. A procedure that a 50-year-old recovers from in days can take weeks or months for someone in their late 70s. Complications become more likely. Recovery becomes harder, and sometimes independence is lost in the process. And third, something called the cascade effect. One test finds a small abnormality. That abnormality leads to another test. That test suggests a procedure. That procedure introduces a risk. And suddenly, a person who felt completely fine is dealing with a situation they never expected. Not because something dangerous was discovered, but because something uncertain was discovered and acted upon. That's the longevity lens. It doesn't say, never test. It doesn't say, ignore your health. It simply asks a better question. Does this test improve your life or just create more medical decisions? Keep that question in your mind, because everything we're about to go through will make a lot more sense with it. Now let's start with one of the most common and most misunderstood. But here's what most people don't realize. Routine colonoscopy after the age of 75. Now, colonoscopy has saved lives. There's no question about that. But like everything in medicine, timing matters. Let me give you a simple scenario. A 76-year-old woman, active, independent, no symptoms, goes in for a routine visit. Her previous screenings were clean. No family history, no warning signs. But she's told she's due for another colonoscopy, so she agrees. The night before the procedure, she takes the preparation, the strong laxative solution used to clear the digestive system. By the next morning, she's weak, dehydrated, dizzy. Instead of going to the procedure, she ends up in the emergency room. Now, this doesn't happen to everyone, but it happens often enough to matter. Here's what many people don't realize. For average-risk adults over 75, routine colonoscopy is often not recommended anymore because the risk begins to outweigh the benefit. There is a real chance of complications: dehydration from the PrEP electrolyte imbalance, bleeding, and in rare cases, a tear in the colon itself. In a younger adult, these risks are manageable. In someone in their late 70s, they can become life-altering. And here's the key point most people miss. The type of colon cancer that might be found during routine screening at this age is often slow-growing, slow enough that it may never actually affect your lifespan. So you go through a stressful, invasive procedure for something that might never have impacted you. That's the longevity lens in action. So what should you do instead? If you have no symptoms, no blood in stool, no sudden changes, talk to your doctor about non-invasive options like stool-based screening tests. And most importantly, ask this question. Given my age and history, what is this test realistically going to change? Because that answer matters more than the test itself. Now let's talk about something that requires a bit more nuance. And this is where things get uncomfortable. Cancer screening. This is where people get uncomfortable because we've all been taught one thing: catch cancer early, and you save lives. And that's true. But after 70, the conversation becomes more complicated because of something called overdiagnosis. Let me explain that in simple terms. Modern imaging is incredibly powerful. It can detect extremely small abnormalities, tiny tumors that might never grow, never spread, and never cause a single symptom in your lifetime. In other words, cancers you would live with, not die from. But here's the problem. The moment something suspicious shows up on a scan, the system doesn't pause. It moves forward. Biopsies, specialist visits, treatment discussions, and often treatment itself, even when the cancer is not truly dangerous. Imagine a 78-year-old man, active, sharp, enjoying his life. He goes in for a routine PSA blood test. The result is slightly elevated. That leads to a biopsy. The biopsy confirms a low-grade prostate cancer. Now he's faced with a decision. Treatment is recommended. Radiation, maybe surgery. He trusts the process, so he goes through with it. Months later, his life looks very different. Chronic fatigue, urinary issues, reduced independence. And here's the difficult truth. There's a strong possibility that cancer would never have affected his life at all if it had never been found. That's overdiagnosis, leading to overtreatment. The same pattern can happen with routine mammograms in older women who have no symptoms and no high-risk factors. This does not mean never screen for cancer. What it means is screen with purpose, not out of habit. So what should you do? Have a direct conversation with your doctor. Ask, if we find something, what are the realistic treatment options for someone my age? And even more importantly, Would treatment actually improve my lifespan or just introduce new risks? Because after 70, finding something is not always the win we think it is. Sometimes, it's the beginning of a chain reaction. If you're still here with me and finding this helpful, take a moment to type 2 in the comments. It helps me know you're following along, and it tells me to keep making content like this. Now, let's move to the one that surprises people the most. And this is where many people get misled. Routine cardiac stress testing. This one surprises almost everyone, because on the surface, it sounds like a very responsible idea. Your doctor says, "You're in your 70s. Let's just check your heart to be safe." So you agree. You get on a treadmill, or you're given a medication that simulates stress on your heart while they monitor it. It feels proactive. It feels smart. But here's the issue. In people who have no symptoms, no chest pain, no shortness of breath, these tests have a high false positive rate. In some groups, it can be as high as 30 to 40%. That means the test may suggest a problem, even when your heart is actually functioning just fine. And once that possible problem shows up, the system doesn't ignore it. It escalates. You're sent for a cardiac catheterization, a procedure where a thin tube is inserted through your blood vessels and guided into your heart. Now we're no longer talking about a simple test. We're talking about a procedure with real risks, bleeding vessel damage, heart rhythm issues, and in rare cases, stroke or heart attack. Then comes the next step. If they find a partial blockage, and many older adults naturally have some degree of narrowing, you may be recommended for a stent. Here's where it becomes even more surprising. Large clinical studies have shown that for many patients with stable heart conditions, stents do not significantly reduce heart attacks or extend life compared to medication and lifestyle changes. Let that sink in. So what started as a routine just to be safe test can turn into test, false alarm, procedure, stent, lifelong medication, all while you originally felt completely fine. So what should you do instead? If you have no symptoms, focus on what actually protects your heart. Blood pressure control, cholesterol management, blood sugar balance, daily movement, even a simple walk, good sleep. Because after 70, those factors matter far more than chasing abnormalities that may not need fixing. Now let's talk about bone health. This is where a lot of people make silent mistakes. This is an important one because the risk of falls and fractures is real as we age, and that's exactly why this topic needs to be handled carefully. A DEXA scan measures bone density. On paper, that sounds useful. You get a result. It shows some level of bone loss, and very often the next step is automatic medication, usually a class of drugs called bisphosphonates. Now, these medications can be helpful for certain patients, but the issue is not the test itself. The issue is the automatic pipeline that follows it. Test, low bone density, long-term medication, without always asking the most important question: is this the best way to prevent fractures for this person? Because here's what often gets overlooked. Long-term use of these medications has been linked to rare but serious side effects. Unusual fractures in the thigh bone, jawbone complications that are difficult to treat, and while these risks are not common, they are real. Now here's the part that surprises many people. The most effective way to prevent fractures in older adults is not medication. It's fall prevention. Simple, practical interventions that have a much bigger impact. Improving balance and stability, strength training, even light exercises, making the home safer by removing tripping hazards, checking medications that cause dizziness, regular vision checks, getting enough protein and vitamin D. These reduce the risk of falls, the actual cause of most fractures. So the real question becomes, are we treating a number on a scan, or are we reducing real-world risk? That doesn't mean medication is never needed. If someone has already had fractures or has very severe bone loss, then yes, it can be appropriate. But for many active adults in their 70s, A scan result should start a conversation, not automatically lead to years of medication. And that distinction matters more than most people realize. Now let's move to one of the most overlooked tests, and this one can be riskier than it sounds. Carotid artery ultrasound. This test looks at the large blood vessels in your neck that supply blood to your brain. The idea sounds logical. If we find a blockage early, we can fix it and prevent a stroke. But here's where things get complicated. As we age, it's very common to have some narrowing in these arteries. In many cases, it has been there for years, stable, silent, not causing any problems. But when you go looking for it, you often find it. And once it's found, the next step is often a surgical procedure to remove the blockage. That procedure, called a carotid endarterectomy, comes with a real risk. There is a measurable chance of causing the very thing you're trying to prevent, a stroke, during or shortly after the procedure. Now, think about that. A person with no symptoms goes in for a screening test, finds something that may never have caused harm, and ends up facing a risk that didn't exist before. This is why many major medical guidelines recommend against routine screening for carotid artery blockage in people who have no symptoms, no mini strokes, no sudden weakness, no vision changes. Because in those cases, the risk of intervention can outweigh the benefit. So what should you focus on instead? The things that actually reduce stroke risk: managing blood pressure, controlling blood sugar, staying physically active, avoiding smoking, monitoring heart rhythm issues like atrial fibrillation. These are the real drivers. Because preventing a stroke is not about finding every blockage. It's about managing the conditions that cause them in the first place. Now, let me give you something practical, something you can actually use at your next doctor's appointment. Because information is helpful, but better questions are powerful. From now on, whenever a doctor recommends a screening test, especially if you're over 70 and feeling fine, I want you to remember these 5 questions. You don't have to memorize them. Just keep the idea in mind. Question 1. What is the false positive rate of this test for someone my age? This tells you how likely it is that the test could send you down a path, even if nothing is truly wrong. Question 2. If this test finds something, what are the realistic treatment options for me? Not in general. Not for younger patients. For you, your age, your health, your situation. Question 3. What are the risks of those treatments or procedures? Every intervention has a cost. You deserve to know it before you agree to anything. Question 4. What happens if we simply monitor this instead of treating it immediately? In many cases, especially later in life, watchful waiting is not neglect. It's a smart, strategic choice. Question 5. Are there safer, non-invasive ways to manage this risk? Because often, there are. Lifestyle changes, medication, monitoring, all with far less risk than jumping straight into a procedure. Any good doctor will respect these questions. In fact, asking them often changes the entire direction of the conversation. Because now, you're not just following a system. You're making a decision. I want to leave you with one simple idea. There's a difference between medicine that finds things and medicine that helps you live well. After the age of 70, that difference becomes everything. Because the goal is no longer just to detect every possible issue. The goal is to protect what matters most: your independence, your energy, your ability to live your life on your own terms. More testing doesn't always mean better outcomes. More intervention doesn't always mean longer life. Sometimes, it just means more complexity, more appointments, more decisions, more risk. The best physicians understand this. They know that choosing not to act can sometimes be the most thoughtful decision. That stepping back requires more wisdom than stepping forward. and you deserve to be part of that decision. You have the right to understand what a test is looking for. You have the right to know what happens if something is found. And most importantly, you have the right to ask whether any of it will actually improve your life. Because at the end of the day, your healthcare should be built around you, not around a checklist. If this gave you a new way to think about your health after 70, I'd really appreciate it if you subscribed. I make videos like this every week, clear, practical, and based on what the evidence actually shows. And before you go, I want to ask you something. Have you ever had a routine test that led somewhere you didn't expect? Maybe something small turned into something bigger. Maybe it helped, or maybe it didn't. Share your experience in the comments, because your story might help someone else make a better decision before their next appointment. Take care of yourself, and I'll see you in the next video.